Researchers pulled together every well-designed human study on garlic for high blood pressure. Over 20 trials, more than 900 patients, most of them over the age of 50. They ran the numbers. The result? Garlic supplements lowered systolic blood pressure by an average of 8 to 10 millimeters of mercury in adults with hypertension. To put that in perspective, that's roughly the same effect as starting a low-dose prescription blood pressure medication from a single supplement, with virtually no side effects. But here's the catch that almost no one tells you. Raw garlic from your kitchen produces less than 10% of that effect. Garlic powder pills from the drugstore produce almost none. And one specific form, the form used in every successful clinical trial, is the only one that actually delivers the result. Today, I'm walking you through every major meta-analysis on garlic and blood pressure in adults over 50. The exact form that works, the exact dose, the 5 medications garlic dangerously interacts with, and the 2 conditions where seniors should never take it. By the end of this video, you'll know whether garlic deserves a place in your blood pressure routine, or whether the garlic supplement on your shelf is wasting your money. Let me start with why garlic isn't just one substance. When you crush a fresh garlic clove, an enzyme called alliinase activates and converts a compound called alliin into allicin. Allicin is the active ingredient. It's also responsible for the strong smell. Here's the problem. Allicin is extremely unstable. It begins degrading within minutes of being formed. Cooking destroys it within seconds. Stomach acid breaks down most of what's left, which means the way garlic is processed, stored, and taken determines almost everything about whether it works. The vast majority of garlic supplements on store shelves are made from garlic powder. The powder is heat-dried, which kills alliinase. When you swallow it, no allicin is produced. The label claims allicin yield, but lab tests repeatedly show that actual delivery to the bloodstream is minimal. This is why garlic powder pills consistently fail in clinical trials. The form that works, the form used in nearly every successful blood pressure study, is called aged garlic extract. We'll come back to why aged garlic is different, but first, let's look at the research. Quick pause. If you've taken a garlic supplement for blood pressure and seen no change, it's almost certainly not because garlic doesn't work. It's because the form you bought has no active compound by the time it reaches your bloodstream. The next 30 minutes will show you exactly which form to buy and how much to take. Stay with me. The landmark meta-analysis came out in 2008, published in BMC Cardiovascular Disorders. Researchers analyzed 11 randomized controlled trials covering 470 hypertensive adults. Garlic preparations, most commonly garlic powder tablets, reduced systolic blood pressure by an average of 8.4 millimeters of mercury and diastolic pressure by 7.3 millimeters. The effect was strongest in patients with starting systolic pressures above 140. In other words, the higher your blood pressure, the more garlic helped. This was the first major signal that garlic wasn't just folklore, but the more important study came in 2012, published in Maturitas, a journal specifically focused on aging health. Australian researchers led by Karen Reid, she's the leading scientist in this field, conducted a randomized controlled trial of 79 adults with uncontrolled hypertension despite being on blood pressure medication. Average age 62. They were given aged garlic extract containing 1.2 milligrams of S-allyl-cysteine daily for 12 weeks. The aged garlic group's systolic blood pressure dropped by an average of 11.8 millimeters of mercury compared to placebo. That's a clinically significant drop, equivalent to adding a second blood pressure medication, and these were patients whose blood pressure was already considered uncontrolled on prescription drugs. The garlic worked on top of existing medication. Then came what most cardiologists who research this topic consider the most important paper, the 2020 meta-analysis by Karen Reid and colleagues. They pooled data from 12 trials, totaling 553 hypertensive patients. Aged garlic extract reduced systolic blood pressure by an average of 8.3 millimeters of mercury and diastolic by 5.5 millimeters. Equivalent, the authors noted, to standard first-line antihypertensive medications. But the analysis went further. They found that aged garlic also improved arterial stiffness,
a measure of vascular age. It improved gut microbiome diversity, and it reduced inflammatory markers. The blood pressure drop wasn't just a number, it reflected genuine improvements in cardiovascular health. Pattern interrupt. I want to address a question I get constantly. Why doesn't my doctor recommend garlic if it works this well? The honest answer is layered. First, most clinical guidelines were written before the major aged garlic studies were published. Second, garlic is not patentable, so no pharmaceutical company funds large trials or sales pitches to doctors. Third, the supplement industry sells dozens of garlic products, 90% of which don't work, making doctors reasonably skeptical of all of them. Fourth, doctors are trained to prescribe medications with predictable, regulated dosing, and supplement quality is notoriously inconsistent. None of these are reasons garlic doesn't work. They're reasons the medical system hasn't fully integrated what the research actually shows. Let's look at one more important study, 2016, published in the Journal of Nutrition. 88 participants with metabolic syndrome, average age 58. They received either aged garlic extract or placebo for 1 year, the longest trial in this area. The aged garlic group showed sustained reductions in systolic blood pressure of about 7 millimeters, plus reductions in fasting blood glucose, total cholesterol, and waist circumference. This addressed an important question. Does the effect last? The answer was yes. The blood pressure benefit didn't fade with continued use. Now let me show you the negative findings, because honesty matters. A 2018 meta-analysis specifically examined garlic powder preparations, the kind you find in most drugstores. The pooled effect on blood pressure was small and statistically inconsistent. Some trials showed modest benefit, others showed none. The conclusion was clear. Garlic powder supplements don't reliably lower blood pressure. The benefit seen in aged garlic studies does not transfer to powder-based products. A 2019 trial tested raw garlic, 4 grams daily, roughly 1 to 2 cloves, against placebo in adults with high normal blood pressure. After 12 weeks, the raw garlic group showed a systolic reduction of about 3 to 4 millimeters. Real, but much smaller than aged garlic extract. The reason, most of the allicin in raw garlic is destroyed before reaching the bloodstream. So across the literature, the picture is clear. Aged garlic extract consistently produces 8 to 12 millimeters of systolic blood pressure reduction. Raw garlic produces 3 to 4 millimeters. Garlic powder produces essentially nothing measurable. Garlic oil, the kind in soft gel capsules, shows mixed results because the active compounds are largely destroyed during oil extraction. Pattern interrupt. If you're finding this useful, if you want more videos that distinguish between the form that works and the form that wastes your money, subscribe to the channel. I publish 2 evidence-based reviews every week, and every claim in this video is backed by studies linked in the free citation PDF in the description. Bring it to your doctor or pharmacist before adding anything to your routine. Now let me explain what makes aged garlic extract different, because this is the part that determines whether you waste your money or actually lower your blood pressure. Aged garlic extract is produced by soaking sliced garlic in 20% ethanol for 15 to 20 months at controlled temperature. During that long aging process, harsh and unstable compounds like allicin are converted into stable water-soluble compounds. The most studied of these is S-allyl-cysteine, often abbreviated SAC. Unlike allicin, S-allyl-cysteine survives stomach acid, absorbs efficiently into the bloodstream, and is the active ingredient measured in successful trials. It is also virtually odorless, meaning aged garlic doesn't cause the garlic breath that puts seniors off the remedy. Aged garlic also contains other stable beneficial compounds, including S-allyl-mercaptocystine, fructans, and antioxidants, all preserved through the aging process. The brand most commonly used in human trials is Kyolic, made by Wakunaga Pharmaceutical. It's not the only quality aged garlic product, but it's the one with the most published evidence. Look for the labels that specify aged garlic extract, and ideally list S-allyl-cysteine content. If the label says only garlic powder, garlic oil, or garlic concentrate, that's not the same product and the evidence doesn't apply. Now the dose. The studies that worked used between 600 and 1200 milligrams of aged garlic extract daily, divided into 2 doses with meals. The S-allyl-cysteine content varied between zero point 0.6 and 2 milligrams daily. The most commonly used regimen, and the one with the most evidence in seniors, is 2 capsules of standardized aged garlic extract twice daily, providing roughly 1200 milligrams total. Start at 600 milligrams daily for the first 2 weeks to assess tolerance, then increase to the full dose. Take with food to reduce any stomach upset. Timing matters less for garlic than for some other supplements. Once daily versus twice daily produces similar effects, but splitting the dose appears to give slightly more stable benefit. Take it morning and evening with meals. How long until you see results? The earliest measurable blood pressure reduction typically appears at 4 to 6 weeks. The full effect builds over 12 to 16 weeks. This is not a fast-acting remedy. Plan for a 3-month trial before judging whether it's working. Use a home blood pressure monitor. Measure morning and evening, same arm, after 5 minutes of seated rest. Keep a simple log. Average your readings weekly. Real data beats vague impressions. Now, let me talk about safety, because this is where seniors most commonly run into trouble. Aged garlic extract is generally well tolerated. The most common side effects are mild stomach upset and rare allergic reactions. Unlike raw garlic, aged garlic does not typically cause heartburn, garlic breath, or body odor. But there are 5 medication interactions you must know about. First, blood thinners. Garlic, in all forms, has antiplatelet effects. It thins the blood. For most adults, this is mildly beneficial. But if you take warfarin, apixaban, rivaroxaban, dabigatran, or daily aspirin, garlic can additively increase bleeding risk. The risk is highest with raw garlic and lower with aged garlic, but it's not zero. Talk to your pharmacist before starting a daily garlic supplement. If you're scheduled for surgery, including dental procedures, stop garlic supplementation at least 7 to 10 days before. This is a real and underappreciated risk. Second, diabetes medications. Garlic has mild blood glucose lowering effects. For seniors on insulin, sulfonylureas, or metformin, this can additively lower blood sugar. The effect is usually small, but worth monitoring. Check your fasting glucose for the first 2 weeks. If you notice readings trending lower than usual, mention it to your doctor. Third, other blood pressure medications. This is the most important interaction for our audience. Garlic adds to the effects of prescription blood pressure drugs. That's often the goal, but it can result in blood pressure dropping too low, especially for seniors who are already well controlled on medication. Symptoms of too low blood pressure include dizziness when standing, lightheadedness, fatigue, and falls. Falls in older adults are a leading cause of injury and death. If you start garlic and notice dizziness, stop and call your doctor. Your medication may need to be reduced. Never reduce prescription blood pressure medication on your own. Coordinate with your doctor. Fourth, HIV protease inhibitors and certain cancer medications. Garlic affects the cytochrome P450 enzyme system that metabolizes many drugs. For seniors on HIV medications or certain chemotherapy agents, garlic can reduce drug levels and effectiveness. If you're on either of these classes, do not take garlic supplements without your specialist's approval. Fifth, birth control pills. Less relevant for our audience, but worth noting, garlic can reduce the effectiveness of oral contraceptives through the same enzyme pathway. There are 2 conditions where seniors should not take garlic supplements without medical supervision. First, bleeding disorders. If you have hemophilia, thrombocytopenia, or any condition that increases bleeding risk, garlic supplements add to that risk. Second, scheduled surgery within 10 days. Stop garlic before any planned procedure to reduce surgical bleeding risk. Pattern interrupt. The free citation PDF in the description below includes the 5 meta-analyses I've cited, the dosing protocol, and a 1-page wallet card you can take to your pharmacist to confirm safety with your specific medications. No email required to download. Let me address some specific scenarios I get asked about. If you're already on prescription blood pressure medication, can you add garlic? Generally, yes, with your doctor's awareness. The evidence is strongest for adding aged garlic on top of medication, especially when blood pressure is not fully controlled. Many seniors find their medication doses can be reduced after 3 to 4 months of garlic supplementation, but the reduction must be done by your doctor based on home monitoring data. Never stop or reduce medication on your own. If your blood pressure is borderline, 130 to 139 systolic, can garlic be enough on its own? Sometimes. This is the population where garlic is most useful as a standalone intervention, combined with the proven lifestyle foundations: sodium reduction, weight management, exercise, and the DASH, or Mediterranean diet. Aged garlic plus those four lifestyle changes can often delay or prevent the need for medication entirely. Track home readings for 3 months. Bring the data to your doctor. If your blood pressure is severely elevated and over 160 systolic, is garlic enough? No. Severe hypertension requires medical management. Garlic can be a useful adjunct, but it cannot replace prescription treatment. Stroke and heart attack risk at these pressures is too high to manage with supplements alone. Can I just eat raw garlic instead? Theoretically, yes, but practically difficult. You'd need to eat the equivalent of 3 to 4 crushed cloves daily on an empty stomach, every day, indefinitely. Most people can't sustain that. The breath, body odor, and stomach effects are significant, and the actual delivered dose of active compounds is still less than what aged garlic extract provides. For occasional cooking use, raw garlic in food provides modest benefit. For consistent blood pressure management, aged garlic extract is more practical and more effective. What about garlic with other natural blood pressure remedies? There's reasonable evidence for combining aged garlic with hibiscus tea, beetroot juice, and magnesium. Each works through a different mechanism, so the effects can be additive without dangerous interactions. But every additional supplement adds complexity. Start with one, establish whether it works, then consider adding a second. Don't start 3 things at once. You won't know what's doing what. Garlic oil capsules, are those the same? No. Garlic oil is produced through a steam distillation process that destroys most of the beneficial compounds. The capsules contain mostly the oil-soluble fraction, which has poor evidence for blood pressure benefit. Despite being widely sold, garlic oil soft gels are not the form used in successful trials. Garlic essential oil for aromatherapy, does that lower blood pressure? No. There's no credible evidence that smelling garlic or applying garlic oil topically affects blood pressure. The benefit requires oral consumption of the right form. Let me give you the practical recommendation. If you're over 60, with high blood pressure or borderline hypertension and not on blood thinners or scheduled for surgery, aged garlic extract is one of the most evidence-supported natural blood pressure aids available. The downside risk is low. The upside is potentially equivalent to adding a low-dose prescription medication, with the additional benefits of improved arterial flexibility and reduced inflammation. Buy aged garlic extract from a reputable brand. Kyolic is the most studied, but other quality brands exist. Look for aged garlic extract on the label. Look for S-allyl-cysteine content listed. Avoid anything labeled simply garlic powder, garlic oil, garlic concentrate, or odorless garlic without specifying aged extract. Expect to pay $20 to $40 for a 1 to 2 month supply. Start at 600 milligrams daily for 2 weeks. Increase to 1,200 milligrams daily, typically 2 capsules twice daily with meals. Track home blood pressure morning and evening. Average the readings weekly. Give it 12 weeks before judging whether it's working. Bring all data to your doctor or pharmacist. Mention every medication you take, especially blood thinners. Stop 7 to 10 days before any planned surgery or dental procedure. What aged garlic will not do? It will not reverse severe hypertension on its own. It will not replace prescription medications. It will not work in 3 days. It is a real but modest intervention that adds to a complete cardiovascular care plan, not a magic bullet. Across 5 major meta-analyses, garlic, specifically aged garlic extract, has earned its place as a legitimate adjunct to blood pressure management for seniors. The chemistry is real. The studies are consistent. The dose is well established. The form matters enormously. And used correctly, alongside the proven lifestyle foundations, it can meaningfully reduce blood pressure with virtually none of the side effects of prescription medications. In the next video on this channel, I'm reviewing hibiscus tea for blood pressure, another remedy with strong meta-analysis evidence and a very specific brewing protocol that most people get wrong. Thank you for watching. Take care of your heart, move gently, and never start anything new without checking with your healthcare team.